SG2 and therefore SG2 Perspectives are being rebranded. As a listener, there's no action needed for you to keep this podcast in your subscriptions and feeds, but you will see a new logo and a new name. SG2 Perspectives is being renamed Edge Perspectives. Same great hosts, same great content, but we're going to expand the way we cover data-driven market intelligence, quality, and operations. This is Edge Perspectives, a weekly conversation about the biggest insights that span market intelligence, quality, and operations in healthcare with the Vizient Strategy Intelligence team and other experts.
It's a really challenging duality. A lot of our reflection this year in assessing some of the recent historical data, it is very clear the incredible strides that organizations have made toward providing more efficient care. But at the same time, we have this emerging trend of the payer mix deterioration, which calls into concern, are those improvements sustainable long term? And how do organizations proactively navigate this environment to ensure that any ground that they have gained as it relates to improving, achieving growth goals?
Welcome to Edge Perspectives. I'm your host, Trevor DaRin. We have one of our most exciting and popular episodes today where we dig into the details of the annual Impact of Change forecast. We have Tori Richie and Karyl Kopaskie here to talk through all the hours of research that goes into the forecast. The most exciting part, what are big themes, trends, and conclusions we drew from that and how it's going to play out in the specific forecast. Karyl and Tori, thanks so much for being here again. What are some of the trends, patterns, analyses, insights, data points, noise, signals that you've paid the closest attention to? How did you assess and interpret that as you go into building the model for how it's going to play out over the next 10 years?
We like taking a data-driven approach to forecasting, and that means assessing recent historical data sets to understand how has the landscape evolved over the last couple of years. In our review of the data this year, we saw an interesting trend emerge. It's not one that we're surprised about, but heartened to see this trend finally appear in the data, a slowing of inpatient growth. The last few years coming out of the COVID-19 pandemic, organizations and markets had experienced incredibly robust year-over-year inpatient utilization growth. And this was something that we didn't think was sustainable long-term. I'm talking 5-10% increase in inpatient discharges year-over-year. From a physical infrastructure alone, we didn't expect this trend to continue into perpetuity. What we're finally starting to see in the recent historical data, and in particular the Vizient clinical database, is year-over-year growth is softening. It was about half in the last 12 months than it was compared to the previous 12-month timeframe. This is a signal of what is to come as it relates to deprioritization of inpatient services and really a shift to the ambulatory environment as being the nexus for care.
We're thinking about what we mean by ambulatory is beginning to evolve as well. Historically, when we talk about the IOC forecast, we have our inpatient discharge growth forecast, our days forecast, and then the universe of outpatient. We're talking about observation and ED in the same breath that we're talking about clinic growth and rehab. As you dive deeper into where are those specific pockets of high growth, our outpatient demand forecast is growing very robustly. But if you actually segment out what are the sites of care outside of the hospital campus, that's where we're seeing the bulk of that growth. It's not necessarily growing in your HOP-D. It's really that universe of ambulatory outside the hospital campus where we're seeing that really strong demand growth. This is something that won't be surprising to folks who have been listening to this podcast every year. We've been talking about inpatient-outpatient shift for over 12 years now. We've talked about site of care migration with pressures from different payers or from the federal government. We've talked about workforce constraints driving team-based care, helping to facilitate that shift to outpatient status. The difference this year and the point that we're really hoping folks can take home with them is that growth you're seeing. We're going to have to be thoughtful about how we navigate some of these big rocks in the healthcare landscape. And we'll need to be really thoughtful about what we mean by ambulatory and how do we find growth there.
Karyl and Tori, so of the historic growth we've seen, it outpaced what we expected. The Impact of Change forecast is about demand. How much of it was the supply was opened up versus demand grew really, really quickly?
It's a combination. If we consider what has transpired over the last 2.5 years, there was a high level of demand that existed in a post-COVID environment. That's the COVID backlog. That's what organizations were working through. At the same time, we were operating in such a supply constrained environment. It was incredibly challenging to work through that demand. What we've seen many organizations prioritize over the last 2.5 years has been focusing on operational efficiency, thinking about how you reduce bottlenecks and reduce friction as you are transitioning patients across different sites of care. The transition between ED and OBS or ED to inpatient, inpatient to post-acute. We've seen organizations work to reduce that turnaround time and all align on performance improvement efforts, whether that's reducing length of stay, whether that's focusing on getting a patient medically ready for discharge, whether that's strengthening relationships with post-acute partners. There's been a lot of focus and attention across the entire system that has allowed for that operational improvement to exist. It's been this combination of, yes, we've been working through a backlog, but at the same time, we've been improving the way we are operationalizing the care that's being delivered.
It's important to pair that also with the dynamics in the patient population. Something that we've talked about for several years is this idea of the rising acuity in the patient population, rising rates of comorbidity, rising rates of complications. We also layer on top of that into the future in the forecast is eroding payer mix. And so something that we've been watching, fascinating insight from the CDB this year, is the payer class segment that is growing the fastest in the inpatient space is the segment that is not covered by commercial Medicare or Medicaid. So this is mostly your self-pay and uninsured patient population. There are some other categories of payer classes in there, but that is where the inpatient growth is going to be coming from. We are also seeing that acuity rise in the ED. Those throughput gains are going to be even more necessary. And we're also going to see continued breakdowns in the system of care that may drive that shift away from more surgical growth opportunities, more preventive care, more proactive care opportunities, especially in the hospital campus, towards medical admissions, those conditions that are being exacerbated from medication noncompliance. The growth that we do see and that we have projected in the inpatient demand is going to be increasingly more complex, more medical patient population as opposed to those surgical case volumes.
It's a really challenging duality. A lot of our reflection this year in assessing some of the recent historical data, it is very clear the incredible strides that organizations have made toward providing more efficient care. But at the same time, we have this emerging trend of the payer mix deterioration, which calls into concern, are those improvements sustainable long term? And how do organizations proactively navigate this environment to ensure that any ground that they have gained as it relates to improving, achieving growth goals and meeting their strategic initiatives, how do we make sure that they don't lose ground in this difficult environment?
One of the most interesting fun parts of building the forecast is the expectation is you do not take a historic trend and straight line it or even think about how is it going to continue in a linear way. Tell me those environmental forces you are anticipating 3, 5, 10 years from now are going to be the biggest things we're talking about.
There are a lot of fun stories built into the forecast. I know one of my favorites this year was how demand is impacted by AI. The one specific case here of real interest and highlights how dynamic the pushes and pulls can be when we're thinking about demand evolution over the next 10 years is in our pediatric evaluation and management visit forecast. We anticipate short term that patients seeking out information from AI will raise more questions, will actually raise demand for clinic visits for pediatric patients. Patients are going on Claude and asking all the questions about what are these symptoms meaning for my patient, for my child. And now we have a more complex in-person visit. We're going to potentially see some throughput challenges. I'm already hearing that from Children's Hospital folks that their specialty visits are getting longer because patients have more questions based on what they're learning from the chatbots. In the long term, you could absolutely see where the promises from throughput, but also the ability of those chatbots to provide offline insight, whether that's harvesting information from the EMR so a patient can ask AI agent more information about their specific treatment and their next steps, whether it's something that could reduce a visit entirely, whether it's better interpretation of diagnostic information so that we can get to diagnosis more quickly. So we have fewer follow-up generic visits where we're still not sure what the implication of these symptoms are. As we get to 5 or 10 years, that's when we actually start to see demand for visits go down as a result of AI. So we've got this sort of bifurcated path where in the short term, we see it actually generating some redundant growth as we see the information may not be as strong. There may be more confusion. We may see more return visits, repeat visits as we learn how to harness the power of AI. But in the longer term, as we begin to deliver on more and more of those promises, potentially being a way to decant some of the E&M visit volume, especially in the specialty clinic space.
There's a lot of detail within the forecast this year as it relates to improvements in treatment options. A really unique example is pain management and how that is likely to follows a similar trend. The conditions where patients experience chronic pain, demand is higher in the near term, but as we see those treatment options scale and become more broadly available, we see growth diminishing long term, and that serves as downward pressure on some of the emergency department growth that we expect to see. Another one we've grappled with is this concept of the underinsured population. We've talked a lot about payer mix deterioration, an individual moving from insured status to uninsured status. But another trend that is emerging is this idea of the underinsured, individuals who have catastrophic plans or plans with very high deductibles, where even though technically they are part of the insured population, the coverage that they have is not comprehensive. And so thus that disrupts how and when and where those individuals are interacting with the healthcare continuum. We expect to see near term some softening in demand, while then their condition becomes more advanced, it exacerbates. There's perhaps onset of disease that could have otherwise been avoided. And that drives additional demand mid and long term within the forecast. That's another example, but a different lever that we've pulled in order to account for some of that nuance across the decade.
We are kicking off a series here where we'll be talking in more depth with some of our service line experts. And we're giving you some of those nice overall stories that impact the forecast more broadly. But what's amazing about the power of this type of forecasting is we have a whole team of experts that spend all their time thinking through these types of specific impacts, these dynamic effects that are going to be impacting demand at the very granular clinical level. We've got updated forecasts relating to the effects of GLP-1s across most of the cardiometabolic conditions in the forecast. And I know we've updated and improved the modeling there. Got some fascinating work going on in the cell and gene therapy space and what those longer term effects are going to be on utilization across inpatient as well as in the outpatient space. Another area of big interest for many of our service line experts was the effects of different medications and a shift towards pharmacy being of major strategic importance at the health system level. So what is the infusion pathway to look like? What are the subcutaneous injection forecasts? How are those going to be interplaying? How does that shift from surgical treatment to medical treatment? And then within the context of pharmacy or the pharmaceuticals themselves, how does the shift from a bispecific to a biosimilar to an oral medication? How does all of that change where and how patients are going to be receiving care? The deeper you go, the more you find. The beauty of the impact factors is that we have that transparent detail and you can truly see where our experts are thinking timing-wise. Different technologies, different pharmaceuticals, different clinical innovation, different policy are going to have those effects, and not just when they're going to happen, but how big of an effect you'll see.
And imagine how hard it is being someone who has to pitch what they think is going to change to Tori and Karyl and have it sync across all the very smart people with their opinions and ideas of how these things are going to change. No small task for you, Tori and Karyl, so we all appreciate it. Zooming out, asking you to put a different hat on. You're the CSO, big, complex health system. You look forward to the impact of change forecast every year. How should they use these insights and ideas going forward as they're thinking maybe even longer term than the duration of their next strategic plan?
Defining the question that you need to answer is really the first step. What's the time frame that you care about? That's the beauty of the impact of change forecast. If you want to look short term, you can isolate on just what's coming in the next 1 to 3 years. You can zoom out to midterm, you can look long term, identifying what exactly it is that you need to be answering. From there, using the impact of change forecast as one of the tools in your tool belt to understand what, from a capacity, from a financial planning, resource planning perspective, what do you need to do in order to be successful long term? How do you ensure operationally the care that you're delivering is sustainable and beneficial to your communities? How do you remain financially solvent given some of the big rocks that we are navigating? Then from there, how do you begin integrating market level detail or local nuance into the forecast so that you're able to model the forecast outputs to take into account those factors that are not possible to capture within a data model, within a single national data model?
The power of forecasting comes by harnessing the details to suit your market, and that is anchored in scenario planning. So using the insights from the expert, we know what the expectations are based on. If we were to imagine the future looks exactly like the past, we can get a model for what that should look like. Layering on top of that, the deep expertise across all of our clinical and enterprise experts, we can look deeply and get into what are the specific pushes that are going to bend that forecast. You can take your local knowledge and say, oh, if I were to deploy these tactics, how can I bend the curve in another way? So I've got my expert perspective. I've got the status quo. I've got my tactics. What is going to let me win in this hyper-competitive market where we know the margin for error is only getting smaller for health systems? So having that power to be very specific about where we're going to play to win and what we expect winning to look like is going to be critical to navigate some of these really big rocks that we're seeing on the landscape.
That's the impact of change 2026. Karyl and Tori, thanks for sharing all the perspectives that went into making one unified national with the ability to be drawn down to any markets level insights. Thanks so much for sharing. Thanks for listening to this episode of Edge Perspectives, a podcast from Vizient. If you have questions or ideas for future episodes, please reach out to us using the email address in the show notes.